listen up, weekend warriors and sports lovers. Don't let joint pain slow you down. There are treatments that will help you stay healthy and active.
Dr. Paul Shirley is a sports medicine surgeon at Southeast Orthopedic Specialists. He can help you explore your options. It's so good to get to know you.
Well,
We've been picking your brain before the show started because we didn't know knees were such an area of focus and really of concern to make sure that you keep them healthy.
Well, we live in Florida, and so at all age levels, we have people competing in sports. People move here, and as we get older, we have a lot of people that remember how good they were, and they still want to do it, and they want to do it at a high level and compare themselves to each others. And so we see a lot of injuries and a lot of arthritis, as well as what I see in the sports practice, where we see young kids with collisions and overuse syndromes, and things like Zumba have been very good to my practice.
Zumba has a lot of good qualities, but you don't want to overdo it. That's what you're finding.
Correct.
Some people are getting in there and they're really trying to overdo it, and then they end up, and they're not maybe as young as they think they are when they go, because they start feeling Zumba.
Exactly right.
They start feeling good and then they overdo it.
Well, I'm sure people come in and they're complaining about arthritis, or what they learn later on is arthritis. What are some of the main components, or what causes arthritis?
Well, arthritis can be after trauma. If you had an injury, you damage the long-term function of the hyaline cartilage, the cushioning in the joint, and it begins to break down. You start to get swelling and some pain. Osteoarthritis is genetic, so if you could choose your parents, choose those without grandparents that have had total joints. Choosing your exercise program with less ballistics and less pounding. Although there are a lot of people who are in their 70s and 80s that still run the marathons. Right. It's better if you try to find a good way to maintain exercise that's not going to overload your joint as it breaks down.
So that's to help you keep your knee healthy, so that you can avoid having to go and get treatment and surgery.
Absolutely.
But if you have to have treatment and surgery, what are some things that you should be doing for aftercare so that you can kind of get back to that good baseline where you're feeling good? Because being sore and achy all the time is just awful.
Yes, I know. Prehabilitation. We start out with exercises ahead of time to get them used to doing them. The surgery itself followed by rehab, physical therapy, and directly aimed at what they had wrong to try not to overload their areas and protect them while they're doing exercise to maintain health of the joint.
I have a dear friend, actually a priest from our church, who was an avid runner for years and years, and now he really has such a difficult time walking. So he said, I should have listened to my body so much earlier in life. What are some of the signs that somebody should say, okay, I need to come see you?
Well, popping that they don't understand, that's painful, swelling, locking where a joint will pop out and lock and they've got to pop it back. Those are definites.
Okay, I'm calling you to
I know, right? I'm like, I do that all the time in this knee.
Yeah, well, generally, if you can't do what you feel you should be able to do, and you're starting to having swelling and pain and dysfunction, your mobility is diminishing, then that's when you consider coming in to see one of the orthopedic surgeons, if it's foot and ankle or knee, to get some ideas as to what can I do to help prevent it. Like, are there glucosamine chondroitin sulfate, does it really help? When do I start in non-steroidals? What's the danger of taking Aleve or Advil? There are a lot of things. What about cortisone shots? What about, there are shots that replace some of the chemicals that are wearing out in the knee. And so now we even have stem cells that we can inject coming from either fat or bone marrow. And we have platelet-rich plasma we can inject. And all of these things have a place in the care, and it helps. But helping the patient decide what level they need to go to, or do they need to go to arthroscopy or surgical levels, is part of what we do.
And that is so fascinating. I mean, I would have never have thought about all those advancements that have been made. I guess I thought I come in, I see you, maybe I get a shot, maybe I have some surgery. So can you talk about how long you've been in this industry and the changes and the impact that you've seen on the ability to treat this pain?
Over the last 150 years that I've been doing this, I did my first surgery in 1968, so that makes me officially older than dirt. And the biggest changes have been the amount of surgery that's needed, the development of the scopes and the robotics, And some of the things and the improvements in biomaterials and biomaterial testing. So where the total joint used to last 5 to 10 years, it's now lasting 30 years. Where the arthroscopy for an ACL reconstruction used to be 2 15-inch incisions, 6 weeks in a cast, staples and screws. Now it's done outpatient and walk them out with inside fixation and doing it all through the scope. So we're learning to build ships in the bottle, and these diminish the amount of pain and improve the long-term results that our patients have.
Well, thank you so much. That's so good to know, because some folks may not know that those treatment options are available and may be hesitant to come in. So thank you for quelling those fears.
And listen for the snap, crackle, and the pop, apparently. Yes, thank you so much. We'd like to thank Southeast Orthopedic Specialists for sponsoring this segment. Schedule an appointment with Dr. Shirley or one of the other providers by calling 904-634-0640. And you can also visit seortho.com.